beautiful family, my YouTube family. You're welcome to another exciting episode of Nursing with Abby. So today, what are we going to be talking about? We're going to be talking about how you can differentiate between a registered nurse and others. That's unregistered nurses, or those who probably they call auxiliary or maybe the quack or untrained nurses. Now, why in this episode I just want to open us up to how you can differentiate, and then why you need to differentiate between registered nurses and unregistered nurses. Now, we know that the job of a nurse has to do with the care of one or more people. The life and the health of such people are in the hands of such a nurse. So, if the nurse has not been certified and licensed and registered to be a nurse, the level of knowledge and competency of such nurses or nurse can be in question. Now, let's dive right into the differences between registered nurses and those who are not registered. Now, I'm not saying that unregistered nurses are bad people, no. I just need to open our minds to understand why it's best to be cared for by registered nurses. Now, we have other cadres of nursing in the hospital environment that include the assistant nurses or unlicensed assistant personnel. It depends on or health assistants. Those ones definitely know their area of jurisdiction. They work in the hospital quite well. They put on a particular type of uniform, but they have their own scope of practice. That's what they can do. And they must always make sure that they don't go across or away from their boundaries, and they always report to a registered nurse. So they are found in the hospital, but they have their own area of expertise, which they need to report to the registered nurse. Now, the first thing is, every registered nurse has to be certified and licensed by the nursing body of that state or country. For instance, in Nigeria, if you're a registered nurse, you have to be certified by the Nigerian, the Nursing and Midwifery Council of Nigeria, and which is in Abuja. Now, they would give a certification or a license which is renewable every 3 years. So every nurse has a license to her name, and that license has a peculiar or unique number. That number cannot be duplicated by any other nurse. So when you go to Nigeria, you say Nigerian nurse and you ask for the nurse's license number. That number will be the number that will fit on the same database as the Nursing and Midwifery Council, and the same data, the same information will be there. And we renew it every 3 years. So if there is any update, if there is any change of name, maybe marriage and all that, there will always be an updating of such information through the renewal of the license on the database at the Nursing and Midwifery Council. That is number one. That means every nurse has a unique license number, and they have a unique license card or plate. Number two, the nurse must be certified and trained in an accredited institution. Now, the accredited institution could be colleges of nursing, schools of nursing, or the university. Not trained in a private hospital. There's a difference between the two. Now, when you're certified in an accredited training institution for nurses, which, like I said, could be colleges of nursing, schools of nursing, or the university to study nursing, those institutions have been verified by the University Council, National University Council, and then the Nursing and Midwifery Council of Nigeria, and they have accredited them to be able to train nurses. That means they have enough lecturers to do so, they have enough expertise, they have enough practical experiences to do so. That means to train those nurses, and then they'll be able to sit for their final council exam, which is organized by the Nursing and Midwifery Council of Nigeria. Now, that examination is the defining body, that is the defining examination that makes you the preparing nurse to pass and then be licensed to be a nurse to practice in Nigeria. Number three, the nurse must have undergone through practical clinical experiences, which is also certified by the Nursing and Midwifery Councils in most teaching hospitals, in state hospitals, in primary health centers, in community health centers, and all round. So it is important that such a nurse is spread across to all those practical experiences. That means the nurse is licensed to practice in a variety of places, and under the instruction of the head of the nursing services in the hospital or the clinical instructors from the school of training. The last but not the least is that the nurse can function in diverse areas, because as a nurse registered in Nigeria, you are exposed to a whole lot of nursing specialties, and then you'll be, after the training, you'll be able to develop your knowledge on the fundamentals that you were given in the training institution. Last of all, the nurse must be able to be licensed. Yes, we said that. Then the nurse must be versed in knowledge, which includes current nursing information and evidence-based nursing care. This includes the nursing care plan, the nursing process. Now, these are the internationally accepted method of nursing practice. Now, it is important for us for nurses to know that this information differs us from others. It gives us an edge to make us understand and know why this is done to a patient and what effect it would give. For example, when a physician administers maybe diclofenac or aspirin, and this client is at risk of gastrointestinal bleeding. Now, your knowledge of gastrointestinal bleeding to the use of aspirin can make you question the physician's orders, because of the safety and health of such a client. Now, if the nurse is not knowledgeable about it and just goes like a dummy and does everything that the physician says, she's accountable for that, because she's supposed to know the drug interaction of aspirin to a person at risk of gastrointestinal bleeding. So you see that the knowledge of a nurse can help to save the life of the patient or the client. So I encourage you. I also love to be treated by a registered nurse, because I believe that she knows what she's doing. My health and my care is in her hands, and then she'll be able to take care of me so well. For as many that are still longing to be a registered nurse, why not? Come in, we have enough room for it. We are trying to, as much as possible, reduce quackery in nursing, because the health and safety of our citizens are in our hands, and we need to do it right. For as many nurses that still striving to get more knowledge, continue striving to get more knowledge, so that we can lift and upgrade the standard of nursing profession. So, my dear YouTube family, I hope I've been able to give you a brief differentiation between a registered nurse and an unregistered nurse, and why you should be treated by a registered nurse. So, till I come your way in my next episode, my YouTube video, it's bye for now.